Hello, everybody, and welcome. It's John Pace coming to you from Vietnam, and I thought I'd just give you a brief update of what it's like here during these pretty terrible times. I know the news is 24/7 about the coronavirus, but most of the news is about the United States or the UK or Italy or China, but we hear very little about what the situation is in Vietnam. And since I've been living here for 7 years, it kind of affects me directly, right? And of course, what goes on back home in the United States is affecting me as well, and I'll get into that in a few minutes. I'm sorry, I know I'm not usually really cheerful anyway, but this is really particularly a terrible time to be living through right now. So sorry if this is a bit of a downer for you. First of all, as far as the healthcare situation, of course, if you're unfortunate enough to be in the United States and contract the virus, the testing, I'm not sure if you have to pay for it or not. I believe testing is free, but even if you have insurance, I believe that the cost can balloon up to $9,000 or $10,000, and I've even seen on YouTube news stories where people have paid $20,000 or more out of pocket if they don't have any insurance. So it's really crippling financially, and that's a big concern of mine because I also have insurance because I'm not covered by insurance in Vietnam. And private insurance is extremely expensive. I pay about $430 a month now. Every year, the premiums just go up and up. And for Vietnamese who need testing or who become sick and need treatment, all their medical expenses are paid by the government. And this is really a relatively poor country, so it really is really great to have universal health care. As far as the hospitals here, I've had to go to the hospitals quite a bit since I've been here. I'm 63 years old already. I smoke, I drink, I don't exercise, I don't eat well, okay? And the care here is excellent. The hospitals are great. The doctors are super friendly and knowledgeable. And best of all, care here is extremely inexpensive compared to the United States. I think my most expensive medical bill that I had was when I developed bursitis in my right elbow a couple of years ago, which was the worst pain that I'd ever experienced in my life. And I went to one of the most expensive hospitals here in Ho Chi Minh City. I believe it's FV Hospital in District 7, and they're quite expensive, and they had to give me some kind of IV. I'm not sure what it was, something to help with the swelling or whatever it was, but they also, since I was there, I did say I'd like to get a kind of a regular physical, a checkup, so they ran a whole bunch of tests and x-rays, and I'm sure that the total cost of my visit there was no more than $200 or $300, so it's really, really inexpensive, and they have very good care here. As far as medicine goes, a lot of things you can get at a pharmacy without a prescription, whereas in countries like the United States, of course, you need a prescription for practically anything. I'm on high blood pressure medication. I take a drug called X-Forge, and in Vietnam, it costs me roughly about $15 a month. And in the United States, the same medicine would cost me about $280 a month. So if you combine that with my health insurance premium, that means if I were to live in the United States again, that just for my health alone, between my insurance and the medication that I'm taking now, my out-of-pocket expenses would be no less than $700 a month, which is pretty crazy. One good thing about living in Ho Chi Minh City, like I do, is that you do have great hospitals, and many people do come from the smaller towns, especially in the Mekong Delta, and because they don't always have the best care there. So many people who live in the smaller cities come up to Ho Chi Minh City for health care. Okay, now I wanted to talk about my biggest worries during this time, aside from not having a coffee shop that I can go to in the morning, which is, I've had this habit of going out for coffee every day for practically my entire adult life, so that's kind of terrible for me, but a lot of people have it much worse, right? First thing I'm worried about is that I'm very susceptible to the disease because I do smoke. My lungs are pretty shot. I'm 63, so I really have to be careful. If I do go out, I always make sure to wear a mask. Almost everybody here does wear a face mask, even before the virus broke out. People in Asia in general, at least in Vietnam, they wear masks all the time, so it's not anything unusual. And I've heard that the World Health Organization and the Surgeon General in the United States have recommended not wearing a mask unless it's absolutely necessary. For example, if you're a medical professional, a healthcare professional, or if you're ill, they recommend wearing a mask, but they recommend other people don't wear masks, and I believe that is a big mistake. I realize that there was a shortage of masks, and there still is, I guess, but wearing a mask does significantly reduce the chances of picking up the virus from the air, from breathing in particles or droplets or whatever. So I believe that I've heard an estimate that it's as much as 5 times greater protection against getting a virus wearing the mask. So, and another thing is, in Vietnam right now, if you're a foreigner and you don't wear a mask in public, people will really be upset with you in a big way. Stores right now are putting up signs in many different languages to let foreigners know that they want you to wear a mask if you're going to get any service. So it's very important. I think it was last week I was going to the Apple repair shop to take my iMac in, and a taxi, a Grab taxi, drove right past me, didn't pick me up, and I was standing there wondering why. Is it because I'm Caucasian or something like that? But I can't remember 100%, but now that I'm thinking about it, I believe the reason is because I was stupid and not wearing a face mask. So it's really important that you wear a face mask. Another worry of mine is the visa situation, because right now my visa expires in a few more months. All international flights are canceled. They're not issuing any visas for foreigners. The only people who can come and go freely into Vietnam right now are like government officials or diplomats. And I believe there's probably 9 million expats around the world in similar situations, and there's also many travelers who are stuck in places, and there's a lot of uncertainty because they don't really inform you what's going on, when you'll be able to get a visa. Nobody knows. So that is something that worries me a lot about the visa situation. I'm also worried about Trump's handling of the crisis. I worry that somehow it will affect my ability to continue to stay in Vietnam. I'm not really sure how exactly or why, but I have a feeling that if it's possible that the actions of the President of the United States could adversely affect my ability to stay in Vietnam. As far as the stimulus checks go, it's not something I'm lucky because I'm not relying on it. Obviously I never expected to get any stimulus check. I'm worried that they're going to send a check and not deposit it directly in my bank account, in which case if it arrives here in Vietnam, there's no way to cash a check from the United States here in Vietnam. And as far as I know, there are regulations against sending checks through the mail here. Maybe it's possible, but it's just an added nuisance, So that's something else that is a slight worry. It's not a huge worry for me. I know for a lot of people, $1,200 is a lot of money. They're out of work. They have to pay their rent or something like that, or buy food. So I know it's serious, but in my case, I consider myself I'm very grateful that I'm not relying on a $1,200 check from the IRS or anything like that. As far as staying informed, the government sends out regular messages on cell phones, so everybody gets updates on what they should be doing to stay healthy, about closures, and staying safe and washing your hands and not spreading misinformation about the disease. Most of those messages are in Vietnamese, so I have to use Google Translate to translate those messages. But anyway, at least they are keeping the public informed. There's also, we do have internet here and YouTube and everything. So I can get all the programs that I want to stay informed about the situation around the world in Vietnam. Sorry if this has been really a depressing video, but some people, especially I know people close to me especially, are interested in what's going on here with me. I'm relatively healthy considering, like I said before, the fact that I smoke a lot and drink and don't exercise and don't eat properly and don't get enough sleep, but other than that, I'm doing fine. I hope all of you stay safe. Make sure you wash your hands for at least 30 seconds with soap and water. We'll see you in the next video. Bye for now.